The Protecting Our Elders Act has just been signed into law, and if you are over 60 or if you have a parent or grandparent who is, there are provisions inside this legislation that directly affect your monthly income, your medication expenses, your safety inside care facilities, and the protection of your financial assets. And here is something critical to understand right from the beginning. Not every benefit in this law is automatic. Some require you to take action, some carry deadlines, and some require you to update your records with the appropriate agency before a specific window closes. So let us walk through what this legislation actually contains, what it means in real everyday terms, and what steps you need to be aware of going forward. For decades, older Americans have been navigating a system that was simply not built to serve them well. Medication costs that bore no logical relationship to what people in other countries were paying. Care facilities operating with almost no real accountability. Annual benefit increases that consistently failed to keep up with what retired people were actually spending each month, and a relentless wave of financial crimes specifically targeting people who had spent a lifetime building their savings. These were not small problems affecting a handful of people. These were deep structural failures quietly grinding away at the financial stability and personal dignity of millions of households across the country. Households where people had done everything right, worked hard, contributed faithfully, and simply expected the system to hold up its end of the bargain. The weight of that frustration has been building for a long time, and it has been felt in very real ways by very real people at the pharmacy counter, in care facility waiting rooms, on phone calls with people pretending to be from agencies they had no connection to whatsoever. The Protecting Our Elders Act addresses healthcare access, housing stability, personal finances, mental wellness, support for family caregivers, and protection from exploitation. Each of those areas contains specific provisions, specific timelines, and in several cases, specific actions that you personally may need to take. Understanding the general shape of this law is a starting point, but it is the specific details that determine whether you actually benefit or not. A lot of people will hear about this law in passing, catch a headline or a brief segment somewhere, and assume that covers it. It does not. General awareness and actionable knowledge are two very different things, and only one of them puts money back in your pocket and protects your well being. So stay with this because what comes later in this breakdown carries just as much weight as anything that comes first. Beginning with prescription medication costs, because this is the area where the immediate financial impact touches the largest number of people in the most direct way. For many years, the federal health insurance program for older Americans was legally prohibited from negotiating medication prices directly with the companies that manufacture them. The largest single buyer of prescription drugs in the entire country, a program serving well over 65 million people, was blocked by law from using its purchasing scale to reduce what it paid. Private health insurance companies faced no such restriction. The federal programs serving military veterans faced no such restriction, but the primary health coverage program for retired Americans did. And the consequences showed up every single month at pharmacy counters across the country, where people were paying dramatically more for the same medications that people in Canada, Germany, Australia, and the United Kingdom were purchasing for a fraction of the price. The same compound, the same dosage, produced by the same manufacturer, available elsewhere at costs that people here would find almost difficult to believe. Under this new law, federal health coverage for retirees can now negotiate costs across a significantly expanded range of medications, and the reduced prices are scheduled to take effect more quickly than under previous arrangements. For someone currently paying $200, $300, or $400 each month for medications managing diabetes, cardiovascular conditions, high blood pressure, or joint disease, this change carries genuine potential to reduce those costs in a way that actually shows up in the household budget. For people managing several chronic conditions simultaneously, the savings in some cases could be significant enough to meaningfully shift their entire monthly financial picture. This law also sets a defined annual limit on what a covered retiree will pay out of pocket for prescription medications across an entire year. Regardless of how many drugs you take or how costly any individual medication happens to be, there is now a ceiling on your total annual exposure. For people who have had to choose in recent years between filling a necessary prescription and meeting other basic living expenses, that ceiling is not a minor administrative detail. It represents a fundamental shift in financial security that changes the calculation entirely. It is also worth understanding how these pricing changes actually work their way through the system, because the timeline matters and knowing it helps you plan ahead. Negotiations do not cover all medications at the same time. The process works through a prioritized list, focusing first on the drugs that represent the highest costs to the program and to the people enrolled in it. That means certain medications will see cost reductions earlier than others. If you want to know whether a specific drug you currently take falls within the current negotiation schedule, the most reliable places to check are the official program website and your own pharmacist. Your pharmacist, incidentally, is one of the most consistently underused resources available when navigating these kinds of changes. They understand how drug coverage tiers work, they know which alternative medications exist at lower price points, and they can tell you specifically how changes in coverage affect what you actually pay at the counter. That conversation is worth having and worth having soon. Moving to retirement income, the central frustration for most people has been the formula used each year to determine how much monthly benefit payments increase. That formula has historically been built around the spending behavior of working age people with regular employment income, which bears limited resemblance to how people living on retirement income actually allocate their money. Retired Americans typically spend a substantially larger share of their budget on healthcare services, prescription drugs, and assistance with daily activities at home. These are categories where costs tend to climb faster than nearly anything else tracked in standard economic measures. So even in years when the official annual adjustment appeared reasonable on the surface, it was regularly falling short of what people on fixed incomes were actually experiencing in their day-to-day expenses. Multiply that shortfall across several years, and the cumulative effect on purchasing power becomes very significant and very real. This legislation moves toward adopting a measurement framework specifically built around how older Americans actually spend their money, meaning annual adjustments to monthly retirement payments will more accurately reflect the real cost of living for people in retirement. Even what might seem like a modest improvement in how that annual calculation is made, when applied consistently over the length of a typical retirement, translates into a meaningful difference in total lifetime income. Additionally, this law takes steps to address the longer-term financial health of the retirement income system itself. Projections had indicated for years that the program's reserve fund could come under serious pressure in the mid-2030s, a scenario that under existing rules could have resulted in automatic reductions to monthly payments. This law adjusts the contribution structure so that people with higher earnings contribute at a rate that better reflects their capacity, improving the financial outlook of the program not just for today's retirees, but for people who are still decades away from retirement. Here is something worth sitting with that rarely comes up in these conversations. If you stopped working at 65 and live into your mid-80s, you are looking at 2 full decades of monthly payments. A more accurate annual adjustment does not only affect this month's check or even this year's total. It affects every single payment you receive for the rest of your life, because each year's adjustment is calculated from the previous year's baseline. Over a 20-year retirement, the cumulative difference between an adjustment formula that reflects your actual costs and one that does not can amount to a genuinely substantial sum of money. That is the kind of long-term financial impact that this law is working to correct, and it is precisely the kind of detail that rarely makes headlines but matters enormously to the people living it every single day. Turning to residential care facilities, the reforms in this legislation deserve considerably more public attention than they tend to receive. Facilities receiving federal health program funding are now required to meet substantially stricter standards for the number of trained care staff present at any given time. The requirement establishes a defined ratio of qualified caregivers to residents that must be maintained throughout the day. Inadequate staffing levels have been documented extensively as the primary driver of neglect incidents, medication errors, and delayed responses to health emergencies inside residential care settings. This law addresses that directly. Penalties for facilities that violate safety standards have also been restructured significantly. Previously, monetary fines were modest enough that some facilities treated them as simply another line in the operating budget rather than a meaningful deterrent. Penalties are now substantially larger, and facilities with repeated violations face the possibility of losing federal health program funding entirely. For the vast majority of these facilities, that funding is the financial foundation of their entire operation. Losing it is not a recoverable situation. There are also new requirements around public disclosure, meaning inspection records, staffing data, and documented violations must be made genuinely accessible to anyone who wants to review them. If you have a family member currently in a care facility, the Federal Health Program for Retirees maintains an online comparison tool that allows you to look up any certified facility and review its staffing ratings, recent inspection results, and any penalties it has received. Under the updated requirements, that information will be refreshed more regularly and will include additional detail. When you visit a facility in person, ask direct questions about current staffing ratios, about how overnight and weekend coverage is handled, and about the process for raising a concern about a resident's care. A facility that responds to those questions openly and specifically is behaving very differently from one that deflects or offers vague reassurances. That difference tells you something important. Financial exploitation of older Americans is an area where this law makes some of its most meaningful investments. Each year, older Americans collectively lose tens of billions of dollars to fraud and financial predation. The methods are wide-ranging. Calls from people falsely claiming to represent government agencies, fraudulent billing through federal health programs, investment arrangements that appear credible until they collapse, schemes targeting people who are isolated or grieving, contractors who collect payment and disappear, and in cases that are particularly painful, theft or manipulation by people the victim knew personally and trusted completely. The shame and confusion that often follow these experiences frequently prevent victims from reporting what happened, which means the people responsible continue operating and targeting others. This law establishes dedicated funding for investigators and prosecutors specifically trained in financial crimes targeting older adults. It strengthens coordination between federal agencies, state law enforcement, and the financial sector. Banking institutions are now expected and in many situations required to identify suspicious patterns in accounts belonging to older customers and follow defined protocols when potential exploitation is detected. A sudden transfer of an unusually large amount, a series of wire transactions to unfamiliar recipients, an unexpected change to account ownership. These are patterns that banking staff are now equipped and obligated to act on. The law also funds broad public education efforts around recognizing common fraud schemes, because understanding how these tactics work is one of the most reliable defenses available. One protective step you can take right now, independent of anything else, is to establish a trusted contact designation with your bank or credit union. This is a person the institution can reach out to if they observe unusual activity on your account. It does not give that individual any access to your funds. It simply provides your financial institution with a point of contact when something looks wrong. Most banks and credit unions already have a process for this, and it typically takes only a few minutes to set up. On housing, this law expands the financial resources available to help older Americans make safety modifications to their homes. Most homes were built without any consideration for the physical realities of later life. Staircases that presented no challenge at 45 become genuine hazards at 75. Bathrooms lacking proper support become sites of preventable accidents. Doorways too narrow for mobility equipment become daily barriers to independence. Through an expanded combination of grants and accessible loan programs, eligible older homeowners can receive financial assistance to install entry ramps, widen doorways, add walk in accessible shower options, improve interior lighting, and make other modifications that support continued independent living at home. There is also broader investment in accessible, affordable housing for older adults designed around both physical safety and social connection, because the health consequences of sustained isolation in later life extend well beyond emotional well being and are documented in the research quite clearly. If you want to find out whether you qualify for home modification assistance, your local area agency on aging is the most effective starting point. These organizations exist in every region of the country and maintain current information on which programs are actively accepting applications in your specific area. Some funding flows through federal channels, some through state programs, and some is administered at the county or local level. A counselor at your area agency on aging can help you identify which options match your income level, your living situation, and the specific changes your home requires. This service is available at no cost to anyone over 60, and it is one of those resources that far too few people know exists or take advantage of. Coverage through the Federal Retirement Health Program has long excluded routine dental care, standard vision exams, and hearing assistance devices, and the health consequences of those gaps are far from cosmetic. Gum disease left untreated has documented connections to cardiovascular complications and accelerated cognitive decline. Uncorrected vision problems are a leading contributor to fall-related injuries among older adults, and the relationship between untreated hearing loss and the development of dementia has become one of the more significant and consistent findings in recent aging research. This law does not eliminate those coverage gaps entirely, but it introduces subsidies to reduce the out-of-pocket cost of hearing devices, funds pilot programs to expand access to dental services through community health facilities, and broadens access to vision care through community-based health programs. It is real progress in the right direction, even while the broader policy conversation about full coverage continues. Access to mental health support through the Federal Retirement Health Program has also been a persistent challenge, largely because many providers choose not to accept that coverage due to reimbursement rates that do not reflect the actual cost of providing care. This law works to improve those rates, which should expand the number of providers willing to see patients covered under the program. It also expands remote appointment options, making it possible for people in rural communities or those dealing with mobility limitations to receive professional mental health support from home. Grief, chronic pain, the anxiety that comes with aging and increasing dependence, the experience of losing people you have known for decades, these are real and heavy burdens that millions of older Americans carry. Having genuine access to professional support in managing those experiences is not a luxury. It is a basic component of overall health, and this law works to treat it that way. For the tens of millions of people across the country providing unpaid care to an aging family member, a parent, a spouse, a sibling, this law introduces provisions that represent the most meaningful legislative acknowledgement of their contribution in recent memory. New tax relief provisions allow family caregivers to recover a portion of what they spend in the course of providing care. Funded training programs help family members managing complex medical situations at home do so more safely and with greater confidence. And expanded temporary relief care options give caregivers the ability to step away for necessary breaks without feeling as though they are abandoning the person depending on them. A caregiver who is rested, trained, and supported provides measurably better care, and the people receiving that care benefit directly as a result. If you are currently in a caregiving role, begin keeping organized records of your caregiving-related expenses now. Transportation, medical supplies, equipment purchases, home modifications made specifically for your loved one. Document all of it. Having clear records in place when tax provisions become available will make the process considerably more manageable. Connecting with a local caregiver support network is also worth doing, not only for the genuine value of peer support, but because other caregivers are often the best source of current practical information about what programs and resources actually exist in your area. Now for the steps that require your direct attention, and this portion matters every bit as much as everything before it. Begin by visiting the official website of the Federal Retirement Income Program or contacting your local office directly to confirm whether any updates to your records or specific actions are required on your part. Every state operates a program providing free, independent counseling specifically to help people navigate their federal health coverage options. Making an appointment with a counselor through that program is one of the most useful, concrete steps available to you right now. These are trained professionals whose job is to help people in exactly your situation understand how policy changes apply to their individual circumstances. Bring your coverage card, your current medication list, and any questions written down in advance. The team at Senior Support USA regularly helps people work through exactly these kinds of questions, connecting older Americans and their families with the information and resources that are actually relevant to their specific situations. If you are not sure where to start or want guidance on how the provisions in this law apply to your circumstances, that is a resource worth knowing about and worth reaching out to. One warning that cannot be overstated: whenever significant legislation affecting large numbers of people becomes public, those looking to exploit it move quickly. In the days and weeks following any major policy announcement, you are likely to encounter contacts by phone, by text, by email, or through social media from people claiming they can help you apply for new benefits or register for programs tied to this law, and asking for your coverage number, retirement income program number, or banking information in the process. Genuine government services do not require payment to access. Federal programs do not initiate calls demanding immediate responses or personal financial details. If any contact you receive feels even slightly uncertain, end it immediately and reach the relevant agency only through contact information listed on their official government website. And if you know an older family member who might be particularly vulnerable to these approaches, have a direct and specific conversation with them about exactly what to watch for before it happens. This law represents a genuine and substantial effort to address problems that have been building for a long time and affecting a very large number of people in very concrete ways. Implementation is a process rather than a single event, and there will be ongoing discussions about funding, enforcement, and the details of how specific provisions are carried out. But the foundation is in place. Staying informed as implementation progresses, knowing which steps may be required from you personally, and remaining alert to the risks that accompany any major policy shift. That combination is the most practical thing you can do right now to make sure you and the people you care about receive the full benefit of what this law puts in place.